Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Hey, y'all. Welcome in for another episode with me, your host, Dr. Nandita Koodie. Today, we're going to be exploring remote patient monitoring. What is remote patient monitoring, or RPM is the buzzword right now, right? The technical term for it is remote physiological monitoring. So we're looking at physiological data, things like blood pressure, blood glucose levels, anything that's going on with the patient internally, like temperature, things of that nature. And so basically, remote patient monitoring is a billable service. A lot of insurance companies have seen the benefit of supporting this service being performed because it's a means for us to manage patients after they've left their primary care office. So what's happening? Essentially, what's happening is you might have a patient come in to their primary care physician's office. They're diagnosed with, let's say, diabetes. And they're given some educational materials. They're walk through what that means. They're walk through maybe what normal values would be expected for a patient who wasn't experiencing that disease state and what their goals are. They may even be given a prescription to go to their pharmacy and to get a blood glucose monitor. And then for about 3 months thereafter, they're not going to see their physician again. So it's pretty much up to them at that point to monitor and manage that disease state on their own. And so there's a huge gap there in care from the point of diagnosis. And even after they've left the pharmacy counter with their medications to then monitor and manage that disease state. They may get some support from the pharmacist at the counter with regard to how to exercise proper technique with the utilization of that glucometer. But ultimately, after they've left, they're really just going to get refills from the pharmacy as long as that prescription is being adjusted and reissued. Remote physiological or remote patient monitoring is a means by which pharmacists can partner with primary care practitioners in their area to be that support person in the thereafter, in the monitoring and managing and educating of that disease state. So the patient's not left to their own devices and trying to figure out how they're keeping up with this new disease state or established disease state. What's great about remote patient monitoring is it's also billable in acute care cases now. So that's great because we can see its application in some of the things that we're dealing with right now, like COVID-19. So essentially what it is we equip the patient with a device such as a glucometer that allows for us to see in real time how the patient's doing, because we are no longer relying on that patient bringing in paper logs and hoping that it's accurate, that it has enough data to make a clinical decision as to what to do for the following 3 months. And instead of that, we have devices that are equipped with Bluetooth or cellular technology that transmits data to the care manager in real time. And that is transparent for the primary care physician, the care manager, the patient, and their caretakers to see exactly what's going on with regard to their levels. That allows us to be more effective in caring and supporting that patient with their disease state. So this is great because it's a tool that allows data sharing on a cloud-based platform, and it can be integrated directly with the primary care system, as well as the patient's smart device that allows full transparency in exactly what's going on without the need for self-reporting or these paper logs that then have to be analyzed and digested before a decision can even be made with regard to how that patient's regimen might need to be adjusted to be more effective. So this is an opportunity for pharmacists to make meaningful interventions and to have a platform that's doing all the digestion for you of the data and collection of the data that you can then just go in and observe how the patient's doing, look for those instances where there's opportunities for positive adjustment, and then make recommendations to the primary care physician and taking off some of that burden of trying to figure out how we're managing and monitoring these patients. So this is something that can be done instantly, and the patient doesn't have to wait 3 months to find out that their glipizide wasn't working for them or that the insulin needed to be adjusted. So this is a great opportunity for patients to be engaged and empowered to handle these disease states on their own. The ball is in their court. They can see how they're doing, and you're bringing to life some of these diseases that are silent otherwise. And they're able to see how they're doing. Like obviously hypertension, it's to the point where they're experiencing negative effects on their body before they realize that something's not right. And so this is a way for us to prevent that and to really reduce hospitalizations, rehospitalizations, and unnecessary and costly trips to urgent care clinics, or having that patient go and have to turn to another practitioner outside of their primary care practitioner just because they weren't available at the time or they didn't have an appointment set up yet. So this is really important because a lot of primary care physicians right now are getting dinged for the care of or lack of care that the patient's receiving outside of their practice just because they're under their care as a primary care practitioner. So this is a way for us to help support primary care practitioners and making sure that the patients are educated and are able to monitor and manage their disease states effectively. And what's really great is remote patient monitoring, or RPM, can be billed simultaneously with chronic care management, which we have discussed previously. And that's the educational piece. That's like the peanut butter to the jelly of RPM. And it's really something that if the patient has 2 or more chronic disease states, can be billed simultaneously with RPM, which most of our chronic care patients easily qualify for. Usually our diabetic patients might also be hypertensive or obese. So it's very easy for them to qualify for both services. So there are several billable codes related to remote patient monitoring. One of them is just setting the patient up on the device. That's something that we as pharmacists do already for free, and this is a way for it to be reimbursable and to actually have dedicated time to make sure we're more effective in sitting down with the patient and making sure they understand exactly how to use that device to best monitor their disease state. There's also a code just for the collection of the data and having it happen automatically to where the patient's not having to deal with the paper logs and stuff. So just that automatic tracking and continuous tracking of data throughout the months is actually billable as a code by itself. There's a separate code that allows for us to interact with the patient throughout the months that we're helping them along their journey to really check in with them, see how they're doing, talk about some of the values that came back over the month, and see where there's room for us to support them in making lifestyle modifications and little fine-tune adjustments to find more success with their regimens. And there are additional codes for additional time spent with the patient discussing these things and managing their disease state alongside them. And this is really an opportunity for us to really bring in some of these biblical counseling activities that I've been discussing with regard to walking us alongside our patients and ministering to them and helping support them and making changes from a biblical standard, looking at issues of sin, issues of temptation, and how we can help correct those things and give them a biblical example of how to walk righteously to finding success in their health where appropriate. So yes, there are several other codes associated with remote patient monitoring and chronic care management as well, whether the patient's in a complex or non-complex disease state. And I'll be happy to discuss those more if you'd like to just reach out to me. That's RPM in a nutshell. It's something that's beneficial for the patients first in being empowered to care for and manage their disease state in a way that they can be excited about it and see how they're doing and be motivated to do better, and for them to be able to take hold of those lifestyle modifications that will make the difference, as well as the care manager to establish better community network relations with the primary care practitioners in their area and with the patients that they serve, as well as the primary care practitioners being relieved of some of the burden of having to monitor and manage these patients between encounters, or having to deal with paper log systems or ineffective means of having to try to figure out what to do next to help these patients along their journey of finding better health. So I hope you've enjoyed this time with me today. If you have any comments, questions about RPM, about how you can go about billing for this service, about how you can collaborate with practitioners in your area to provide this service as a consultant or as a pharmacist, I'd be happy to share with you. You can always email me at n.koodie, that's n.koodie @pbh.live, or message me on any of the social media networks. If you enjoyed this episode, please subscribe to our YouTube channel at Perfect Balance Healthcare and learn more. Thank you for spending this time with me. I hope you enjoyed this episode, and we'll see you back next time. Thank you for listening to this episode of Lipstick and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.